White matter disorders are complex, involving the nerve fibers that carry signals throughout the central nervous system. Understanding these conditions is crucial for diagnosis, treatment, and ultimately, improving the health of affected dogs. We'll focus on 3 specific breeds where these conditions have been recently described or further characterized. The Leonberger, the Rottweiler, and the Border Terrier, examining the clinical signs, the findings from advanced imaging like magnetic resonance imaging, and the detailed changes seen upon microscopic examination of the affected tissues. This comparative look helps highlight both the shared features and the unique aspects of these breed-specific diseases. Before continuing, be sure to like, share, and subscribe as proceeds generated from this channel will be donated towards animals in need of veterinary care.
These disorders can present in different ways and often affect young to middle-aged dogs, leading to progressive problems with coordination and movement. For instance, a novel disorder has been identified in the Leonberger dog. Affected dogs typically present with initial signs around 2 to 2.5 years of age. The clinical signs often begin intermittently, but then worsen over a period of months. Owners might first notice spontaneous knuckling in the front limbs. As the disease progresses, dogs develop a more generalized lack of coordination, or ataxia. A characteristic finding is a hypermetric gait, particularly in the front limbs, where the dog appears to overreach. Proprioceptive deficits, meaning the dog has trouble knowing where its limbs are in space, are observed in all limbs. Some dogs show stiff or stilted steps, or drag their paws while walking. Despite these significant neurological issues, routine blood work and cerebrospinal fluid analysis are often found to be within normal limits. This lack of inflammatory changes on standard tests can help guide the diagnostic process away from infectious or inflammatory causes, although infiltrative diseases still need to be considered.
The clinical signs you described certainly point towards a problem in the pathways of the nervous system responsible for movement and coordination. This is where advanced imaging, such as magnetic resonance imaging, becomes incredibly valuable in the diagnostic workup for these cases in live animals. In the affected Leonberger dogs, the findings on magnetic resonance imaging were quite distinctive. The most obvious lesions appeared as areas with increased signal intensity on specific types of imaging sequences, like the T2 weighted images. These changes were primarily located within the dorsolateral funiculi of the spinal cord. A crucial observation was that these lesions were typically bilaterally symmetrical, meaning they affected both sides of the spinal cord equally at certain levels. They extended vertically, in one case from the 1st to the 4th cervical spinal cord segment, becoming less intense further down. In another case, the lesions were seen in the dorsolateral funiculi of the 2nd cervical segment, also symmetrical and with increased signal intensity on T2 weighted images. Importantly, these areas did not show any abnormal contrast enhancement.